got a riddle for you. I'm a 35-year-old male with no significant past medical history who presents to the clinic with the chief complaint of a flaccid paralysis in the upper and lower extremities. I've had this paralysis that's been getting worse over the past 48 hours. It started in the hands and feet and seems to be spreading towards the torso. I've also noticed that I've been short of breath lately, and it seems like the work of breathing is a lot heavier these days. I don't have any rashes or lesions on my skin that I've noticed. I don't have any feelings of excessive sweating or decreased sweating or fainting or nearly fainting or slow heart rate or fast heart rate. I also deny any bullseye looking rashes that I've noticed, and I didn't notice any ticks on me after I went hiking about a week ago. Physical exam was unremarkable. Normal cardiopulmonary exam. Kept my clothes on, but you didn't notice any rashes or lesions on my skin. And you didn't notice any orthostatic hypotension. Vital signs were within normal limits, except for a respiratory rate, which was, let's say, 8 breaths per minute. Your suspicion. And so after you've looked into the eyes of the patient and made sure the patient hasn't had headaches over the past few days and had no papilledema on retinal examination, you decide it's reasonable to order a lumbar puncture. You do that, and the results are as follows. You had a normal protein count, normal cell count, normal glucose count. Everything seemed to be normal, including the opening pressure. My question to you is, who am I? Who am I? Who am I? Who am I? Who the hell am I? Have you figured out who I am yet? I'll tell you who I am. I'd tell you without a doubt who I am. I am tick neurotoxin causing tick paralysis. Now you may be saying, hey, you said there was no ticks on physical exam. No. I said, the patient said, you didn't notice any ticks on him. And physical exam was done with clothing on. You can never do a real tick examination with clothing on. And so this is a tick attached somewhere on this patient's body, releasing tick neurotoxin from their salivary glands and poisoning the release of acetylcholine at the neuromuscular junction, preventing its binding to the nicotinic acetylcholine receptor, preventing the formation of a graded potential that ultimately leads to an action potential and ultimately leads to the contraction of muscle. Hence, you block that, you got a flaccid paralysis. Happens to be ascending, very similar to Guillain-Barré syndrome. However, the differentiating factor between these two entities is that the tick neurotoxin or tick paralysis will have a normal CSF analysis, whereas Guillain-Barré syndrome will have an elevated protein count with a normal cell count. Tune in next time, yeah? I hope you enjoyed that video. Just to make sure we're on the same page, I wanted to do a quick slideshow at the end of the video to make sure you can make this diagnosis in the future. Tick paralysis is caused by tick neurotoxin. The toxin inhibits acetylcholine release at the neuromuscular junction and is released by the tick salivary gland by the attached tick. Yes, that means that this tick has to be attached for over a week, probably in some intertriginous region like, the armpits or the groin area or maybe in the scalp, and secrete this neurotoxin for a patient to get tick paralysis. That incubation period is about 2 to 7 days, so think of it as something presenting perhaps a week after someone has been on a hiking trip. It starts with weakness in the upper, the lower extremities, but really just, an ascending flaccid paralysis that progresses rapidly now over the course of 24, really to 72 hours. That can lead to respiratory failure due to the respiratory muscle weakness, that is, the phrenic nerve innervating the diaphragm becomes weak because that is somatic motor neuron, and that is a neuromuscular junction. There's no fever or rash in tick paralysis. There is, an ascending paralysis with normal CSF findings and without autonomic dysfunction. That implies to you tick-borne illness. Now, that is autonomic dysfunction is what I described to you in the patient's presentation. So they didn't have any tachycardia or bradycardia. They didn't have any faint syncope or near syncope. They didn't have any anhidrosis or hyperhidrosis. So that would be normal autonomic function. It was absent in this patient. Again, the treatment is to just locate and remove the tick and supportive therapy. The symptoms abate very quickly after removing that tick. I did a quick and dirty sketch here, really quick and dirty, just showing you these ticks sort of climbing on to this patient, showing you that it is an ascending flaccid paralysis, more common in younger children because they don't, they jump in bushes and what have you. And I wrote this 10 on his chest to remind you that, more common in younger children under 10, and about the give or take the incubation period. And he's saying, I can't move doc again for that ascending flaccid paralysis. The differential diagnosis for this is Guillain-Barré syndrome, which we already said we can differentiate, one, due to the absence of autonomic dysfunction in the tick paralysis, and two, and more specifically, more diagnostically, the normal CSF findings in tick paralysis as opposed to the elevated protein with normal cell count in Guillain-Barré syndrome. Do you know what that's called? Little step 1 trivia. Albuminocytological dissociation. That's seen in Guillain-Barré syndrome. That's also seen in CIDP, or chronic inflammatory demyelinating polyneuropathy. However, that is a chronic ascending flaccid paralysis occurring over the course of approximately 2 months. So that's how you differentiate those three there. And I hope you enjoy the video and come back next time for some more medical riddles.